Hi, everyone. Welcome to the MDH Stroke Program Monthly Education Series. With Stroke Awareness Month of May just around the corner, we wanted to share some statewide stroke awareness activities and resources to hopefully give you some inspiration on what to consider this year in your programs and in your communities. Before we get started, I have just a couple housekeeping and announcements to share. This webinar is part of the MDH Stroke Program Monthly Education Series. Stay tuned to your email for a different educational opportunity each month. You can access all of our previously recorded webinars on our MDH YouTube playlist. Your lines have been muted upon entry. Please ask questions by typing them in the chat or hold them for the closing. If we don't get to your questions today, we will address them in the follow-up email. Please also feel free to reach out to us at any time. Finally, please note that this webinar is being recorded. I wanted to take another minute to share a few tips on how to navigate while you're in the WebEx meeting and how to engage with us. As mentioned, you can share your questions using the chat feature. To do this, please click on the chat bubble icon. Click Everyone, type your question or comment, and click Enter. Upon time for questions at the closing, you can also raise your virtual hand and lower it to also ask your question. Please also feel free to engage with us throughout the presentation by using the reaction icons. To do this, just select the emoji icon bubble as shown in the slide here. We would love this to see how you are reacting to what we have to share with you. I have a few program announcements. 2023 is a very exciting year for the MDH Stroke Program and for our state. This year marks the 10-year anniversary of the Minnesota Stroke System legislation. Congratulations and thank you for your contributions and participation in the stroke system of care over the last decade. Coinciding with this big anniversary, we officially kicked off the 4th round of Acute Stroke Ready Hospital designation this month. If you are unsure when you are up for redesignation or considering designation for the first time, please contact our team. The 2023 Hospital and EMS Stroke Quality Improvement Award season is currently open. Please visit our website for more information. Please also continue notifying our team of any program contact info changes. Today, we will share a snapshot of the many Stroke Awareness Month activities occurring throughout the state. You will hear from MDH, a few of our partners, and upon completion of this webinar, you should be able to access MDH Stroke Awareness Campaign resources, identify 3 statewide community or hospital or partner Stroke Awareness Month activities or resources, describe why it is important to raise awareness of stroke signs and symptoms and to call 911. Let's first take a look at what MDH is up to this year. The Every Second Counts is the MDH Stroke Program Public Awareness Campaign. Our BFAST messaging may be recognizable to you, as it is how we brand our swag from magnets to hand sanitizer and our stroke awareness materials from posters to bus ads. Our goal is to create simple, recognizable, and consistent messaging. Our messaging materials are available for hospitals, EMS, public health, and any other partners around the state interested in raising awareness of stroke. MDH raises awareness of stroke to encourage faster recognition of stroke and recognizing stroke as an emergency, leading to more people calling 911 and more quickly, shorter last known well times, thus increased number of candidates eligible for treatment and overall decrease in stroke mortality and disability. The Every Second Counts Communications Toolkit houses a wide variety of awareness strategies, including media release, advertising, social media, and materials to utilize as you please. The materials are in the form of graphic files that are free for you to download and print in multiple languages, including English, Spanish, Hmong, and Somali. Here's a peek at what the images look like. There's an infographic, a newspaper ad, social media graphic, a billboard, a poster, and bus ad. Each image has a place for your organization's logo or website, and each image has 2 versions, one with and one without the MDH logo. This should make it easier for organizations that have difficulty co-branding. To access the toolkit, visit our Every Second Counts public awareness webpage and click on the link that says Stroke Communications Toolkit. Next, using the link provided in the toolkit or on the same webpage, click on the Every Second Counts Toolkit request form, which is the order form to access the free graphic files. Mimi is going to drop this link directly for you into the chat today. The form will also ask for basic information about your organization and how you plan to use the materials. Once submitted, the form will direct you to a link to a Dropbox folder. This is where you can download any and all of the files to print and start using right away. Please contact our team with any questions or support. Now let's talk a little more about how MDH is utilizing these very resources next month. This May, with the support of our fantastic communications colleagues, MDH is celebrating Stroke Month by getting the message out about BeFast. Our overall objectives with this effort are to raise awareness of the stroke emergency warning signs, BeFast, and to call 911. We also wish to highlight the great work you have done making stroke care more accessible and also share tips for stroke prevention. We hope to focus on the following target audiences: Minnesotans at risk for stroke, those with loved ones at risk for stroke or who have had strokes, and clinicians, providers, healthcare providers. MDH stroke awareness strategies this year include weekly social media posts, so find us on Facebook. Please like our posts and feel free to share your own. We will be sending a special edition message via the CVH newsletter, the Cardiovascular Health newsletter. BeFast messages on select Metro Transit stops, supporting our MDH partner communications. And we are excited to participate in the Minnesota Stroke Association Strides for Stroke Walk at the Twin Cities location this year as both a sponsor and a walker. We are the MDH Stroke System Striders. It's a tongue twister. If you're looking for a Saturday walk, feel free to join us. Let's switch gears and hear about some of our statewide partners and what they are up to next month, including events and activities and resources available to your programs. The American Heart Association has created a webpage dedicated to American Stroke Month 2023. The AHA team has also assembled an American Stroke Month toolkit to support your own Stroke Month programming. The kit includes public awareness tools, stroke-focused staff engagement, and patient resources. Finally, the American Heart Association is hosting their annual Twin Cities Heart Walk on Saturday, May 20th at Target Field. Connect with the American Heart Association for more information on the walk, resources, and more. Genentech has a wide variety of stroke education and resources to help empower communities to recognize and react to the urgency of stroke. The Stroke Urgency Toolkit, or YouTube channel, features educational videos highlighting stroke symptoms, personal stories, and lessons learned from patients and caregivers. Patient education materials are available free of charge within the corresponding Stroke Urgency Toolkit. Also listed on this slide is Genentech's Stroke Awareness webpage and the Association of Diabetes Care and Education Specialists webpage with materials geared toward high-risk diabetic patients. Genentech sponsored ADCES to create a stroke awareness materials centered around these individuals. This will greatly enhance awareness for those who have not had this type of education available to them in the past. The Minnesota Stroke Association has joined us to personally share their events, activities, and resources available to you and your programs. Katrina, at this time, I'll turn it over to you. Thank you.
Wonderful. Thanks for having me join today. As Michelle mentioned, I'm Katrina Meyer with the Minnesota Stroke Association. We can go ahead to the next slide. For those of you who aren't familiar with us, just a quick overview. The Minnesota Stroke Association is a nonprofit that supports stroke survivors with accessing supports, resources, and information throughout the recovery process. We go on next slide. So the goal of our organization overall is we have this mentality that a brain injury or stroke can impact any and every area of life. So we try to have a variety of programs to support that. Next slide. So with May being Stroke Awareness Month, we have had our Stroke Awareness Walk for a number of years now. And we're happy to say that it's going to be back to being in person. We've been virtual due to the pandemic for a few years, but we're back to being in person. It'll happen May 20th at 10 a.m. There's information about how to register on this slide that will be distributed later. And one note that we like to make is we really encourage people to invite patients, support groups, things like people like that, as well as your coworkers and staff to participate in these walks. And if finances, like we don't have any registration fee for this walk to make sure that it is accessible to all survivors and people who want to participate. Our main goal is just getting people together to celebrate and also raise awareness. Those are our main goals with this. If we can raise some extra funds to help do some more programming, that's amazing, but main goal, raising awareness. Next slide. Another activity that is constantly ongoing is our brain injury basics and stroke basics classes. These are free educational classes that happen over Zoom, and anyone is able to participate in them, no matter what type of brain injury or stroke they may have had, how long ago it was. There's just 3 sessions that we rotate through on a regular basis. This is a great resource to direct family members to, survivors to, even if the family lives out of state, this is still something that's accessible to them. So for folks that struggle to be able to come into the hospital for education, this is an element that can be helpful for them. And people are able to sign up just through the website that is listed at the bottom. And next slide. Another activity that's ongoing, but that we really highlight during our awareness month, like Stroke Awareness Month, is our Unmasking Brain Injury in Minnesota project. So this is like the wide term of brain injury that encompasses stroke. And so what it is it's a statewide therapeutic art project that's been going on for 5+ years in Minnesota, where individuals that have some interaction with brain injury or stroke are able to create these masks that depict their experience and are able to then also write about it. And then those masks are oftentimes displayed in different areas to help raise awareness about stroke and brain injury. And these are free events that we do. We bring all the materials and everything. We basically just ask the host to provide the space and the people. And we'll bring everything else and run the event. So that's something that is open to anyone that's interested in the community. And then just as another thing, especially if you have a support group or if you just want to have some activity around raising some awareness, we created a documentary about 5 years or a few years ago now, 2 years ago, about the process of making these masks, and that's about an hour long and free on YouTube. Next slide. And then also, I just want to make a quick note about resource facilitation. This is a program that's always available, and I've spoke about before to this group, and there's more information on the MDH stroke playlist. But a few highlights that I just want to talk about that are some updates are that we are we've made some updated flyers that have QR codes on them. And that was done out of a partnership with the St. Cloud Centricare. They brought that idea to us, and we were able to come forward and put QR codes on the form so that people can link directly to our online referral form, which was just something that they decided would be quicker for them. And we agreed that that's a great idea. So we decided to do that and promote that to everyone. Similarly, North Memorial had reached out to us asking about flyers for their waiting rooms. And so that's another thing that we've created. And those flyers also have a QR code that link to our website for more information and support in accessing resource facilitation. So those are things that are going to be available. All of them are also, you can co-brand any of them. And I'm happy to chat more with people directly about any of that. And also, if any of you have additional ideas of how connecting patients can be more effective, I'm always open to those conversations and seeing what I can do to make it as easy as possible for you and for the patients. Next slide. So I just wanted to close this out with saying that we've already had a bunch of hospitals reach out to us about doing things for Stroke Awareness Month. And it's not too late. We can still get things set up if it's something that you're interested in. But one partner in particular I want to highlight is Amy up in Sanford, Bemidji. She has worked closely with our organization to set up a Stroke Awareness Day up in Bemidji, where we are going to be doing an unmasking mask making event, bringing in some stroke education, doing a stroke education class, and then also talking with some of their staff about supports and resources and making sure everyone is up to date on things. And it is just a great combination of being able to make this big event come together that I know Amy has put a lot of work into on her end. And so we are really excited to partner with her on that. And I think that is everything for me.
Thank you, Katrina, for all the great information and of course for your partnership. To close up, we are going to hear a snapshot of stroke awareness activities led by local hospitals. I would like to turn it over to one of our hospital partners, Essentia Health System, to share as a coordinated system what their programs have in store at all levels of stroke designation. Elsie, I will now turn it over to you and your colleagues. Thank you.
All right, thank you. So my name is Elsie and I work at St. Joseph's Medical Center in Brainerd, and we are a primary stroke center. If you want to go to the next slide, here we go. So as Essentia Health Stroke team, we have been working together to share and better utilize resources. With this, our team's collaboration has included marketing of our stroke programs and stroke awareness resources and ideas. So the first few slides that I will work on presenting are stroke awareness that are available system-wide for all of our hospitals in Essentia. Starting with this screen here, we can see the BFAST acronym, and this is used as a screensaver that rolls through all of our hospital and clinic computers the month of May. Next slide. Next are BFAST, either elevator or unit postings with flyers or pull down banners, which each hospital and or unit posts as best fits their location. Next slide. Stroke symptoms and risks are also shared via social media. These posts include a direct link to our Essentia Health Stroke page as well. With social media, we are also planning on sharing survivors' stroke stories that have occurred at some of our hospitals. Next slide. Some fun activities we have developed include stroke colorings, crosswords, word searches and scrambles, and mazes. These activities have been used for staff awareness and can add some fun and competition between staff and units. With competition of an activity, a selected staff member or unit wins a prize. These activities have also been added for more visual and take homes at nursing homes and assisted living facilities around our sites. And next slide. Lastly, for system-wide, we did develop these BFAST t-shirts last year that are available for all of our staff members. And next, we'll go into more specific sites. So I will turn it over from Chelsea, who is one of our program managers up in Fargo.
Hello, everybody. Thanks for having us today. My name is Chelsea. I represent the Comprehensive Stroke Center within our Essentia system. And so first of all, I will talk about our Strides for Stroke event. While, it kind of is based out of Duluth, we also have an arm of it as well for our stroke support group that we host in Fargo. So these are pictures from last year's event. We also had the North Dakota Brain Injury Network come to our Strides for Stroke event as well. And this is various colleagues and stroke survivors and their support people. So we had a great day walking outside with them last year, and we will also do this year as well. Next slide. Then the next thing we do, you can see my colleague Molly up front. She has a hat on, and if you can kind of see, there's chicken wire on top. She is our stent. And then I'm in the back with the balloons on my shirt. I was the clot. So we called it Clots and Coffee. While I'd love to take credit for this idea, we did find this from Penn State in Hershey, Pennsylvania. They were the original idea people for this. So we ended up doing this. So we brought around coffee, which was our thrombolytic, and then donut holes, which was our clot, and then educated our staff on strokes and stroke awareness. We went throughout the clinics, the inpatient units with this, and then for the clinics, we brought them little goodie bags with Tootsie Rolls that said thanks for your role in stroke care, and then did a brief little education with them at each site as well. So that was kind of our tour of not only the inpatient departments, but also the clinics. So we had a lot of fun with that. All right, next slide.
Hello, everybody. My name is Brian. I'm also with Essentia, but up in Duluth at St. Mary's. And as many of you know, we have a new building that's coming around. Opening day is actually this July. Equipped will be a bunch of new equipment, new CT that's going to be really close to the ED, so we're hoping that some of our door metrics will improve just by mere placement of our machines, and then updated equipment for the OR so we can complete those thrombectomies. And a lot like Chelsea said, our floors also participate in many of those games, and coming from the floor myself, they're actually a lot of fun, and they do create some kind of fun competition amongst different units and different sites. So, next slide.
Elsie, you're muted if you don't mind.
So here at St. Joseph's, we just got done with our annual DNV survey, which was a recertification year for us. Along with that, we were awarded MDH Hospital and EMS Collaboration Award this last year. So part of our Stroke Awareness Month, we're really going to celebrate our accomplishments that we have done throughout the year, both within our emergency department, our stroke unit, and then we are also hoping to get out to our EMS agency and share with them as well, since they were part of one of our awards. Next slide. With the recertification year, we are also hoping to do some marketing with a potential patient story here locally. And next slide. Lastly, we really tried to get into some of our assisted living facilities. During COVID, it was difficult to get out and do community education. And so we started doing or partnering with some of our local elementary schools that color cards for us. And then I usually just stick in like the BFAST magnet or some sort of fun activity for the assisted living members. And since we've had such positive feedback, we have continued to do this for both our schools and our assisted livings. Next slide.
Hi, my name is Leah Grody, and I'm representative of Essentia Health Virginia and the Arrowhead region, and we are acute stroke ready hospitals. So this year is going to be, we did a virtual Strides for Stroke last year, as you can see, we did it at the mall. But this year we're hoping to have a bigger presence in the Arrowhead and hopefully working with marketing to have like an official area here up on the Iron Ranger in the Arrowhead, you know, to represent all of the areas that are north of Duluth. So this is actually one of the person in this picture is dear to our heart. She is one of our RNs here in Virginia, and she is a stroke survivor herself, and she'll be doing a little bit of a talk or a little share of her story at our Strides for Stroke event this year, where we're walking around Silver Lake here in Virginia. Next slide. So at nursing homes and assisted living, I provided some education. Time is Tissue. It was doing both stroke and STEMI education. This was the poster that I created for a staff education. We did a poster fair, and I had done stroke and STEMI, so I created some games. One of my process improvement projects is really getting more EMS arrivals for acute stroke than walk-ins, knowing when to call 911. And then is there a next slide? I can't remember. Oh, and then one other thing is working with our EMS this month. I'm going to be working with some of our Northland EMS providers in their education days and just bringing resources. We have the magnets that Elsie has shown, and then the BFAST and the VanSign badge buddies, and then our NIH stroke scale little books that we kind of hand out as a resource as well. Thank you.
Fantastic. Thank you so much. Huge thank you to our Essentia Health stroke coordinators across the state and all of our community partners that were represented or spoke today, and all of you on the line for all of your efforts this Stroke Awareness Month and really throughout the year. It's a 365, 24/7 gig. We hope this webinar provided you with some inspiration and ideas and maybe some new connections. We'd love to hear what you thought about today's information. You could use a reaction, place a question in the chat. And we do have time here if you wanted to unmute your line and share any questions or comments with us or any of our presenters today.
This is Jackie Fireisen. I was watching and I copied down the website to get the tip sheet, but then there was something from MDH that also was available, and I didn't catch that website.
Hi, Jackie. Thanks so much for your question. There are actually there was quite a bit of choices from tip sheets to poster size infographics, and some just electronic graphics that you could use in social media. If you were to scroll up, Mimi did put the order form directly in the chat, but if you want to, we could talk offline here and share our screens and make sure I get you everything that you needed. You know, the one thing to note is they're the graphic files that you download, which then your program prints, just to make that clear in case that's part of the confusion. Did that help, or otherwise we can talk after?
No, I think that helped. There was the first one was the one that has branded and co-branded and unbranded, and then there was a second site that you could go, and I'm not sure which one.
if it's the other link that I put in this website, that's then actually for the communications guide, the toolkit guide. So that's the walkthrough of how to use the
Oh, okay.
downloads.
Okay,
So there's the resource and then there's the link to access the downloads. Maybe,
gotcha.
but feel free. Yeah, I'm here. I'm around. So feel free to just reach out to maybe put it in the chat.
Thank you
Clarify any
very
of that further.
All right, thank you very much.
And I will make sure that all of these links with a little bit clear instruction will go out in the follow-up email. And I plan to get that out as soon as possible before it's even up on YouTube, just to make sure you have these things before May is just around the corner.
Thank you.
Thanks for the question. Any questions pop up in the chat? Okay. Well, the link to the survey is placed in the chat as well here. Thanks, Mimi. Remember to click on that chat bubble in order to view the chat box so you can see that link. Upon completion of the evaluation, you will receive a 0.75 contact hour for today's webinar. We are a little short here of that 0.75, so we're happy to stay on the line and answer any more questions. If you're watching the YouTube replay, please expand the description box and click on the survey link for that contact hour. Please otherwise stay tuned to your email for all of our monthly education opportunities that we have coming up. We've got an excellent lineup of education this year. We wish you a happy Stroke Awareness Month, and we thank you for all that you do. We will hang on here if there are any other questions.
I think I was muted. I was just going to say that for North Memorial, we did coffee sleeves that say "Be Fast," and they have a QR code that links to our website. And those coffee sleeves will be on every hot drink on all patient trays. And it will be also, they'll be used in the cafeteria for any coffee that visitors order. And Maple Grove is doing it also on their patient trays.
Love that contribution. Thanks for sharing that.
I got it from a conference, but it was good.
Great idea. That's a new one. Okay, folks, I think that wraps us up. We're not seeing any other really questions come in. So thanks again for all you do. And again, happy Stroke Awareness Month.